Welcome back, school. It's officially back in session, or at least soon will be for most of West Michigan kids. It means change, right? This is a transition. It's all about change.
That's right. And to make sure parents or caregivers are setting kids up for success, Rebecca with Mercy Health Physician Partners in Jenison shared some tips on how to make sure children are prepared.
I think there are a number of things parents can do to get their children ready for school. I think one of the most important things that they can do is just talk about it. Address the reality that it's normal to be nervous. And it's exciting to start new things, and just have the conversations with your child. What are you the most excited about? What are you looking forward to? What might make you nervous about starting the school year? I have a 5-year-old going into kindergarten, and we ran into a teacher at her school who just gave her the sweetest advice that teachers are nervous too, and teachers don't know their classes yet. And it was a great reminder, I think, that it's normal to be nervous. And so just addressing that and talking about it is huge. I think routines are hugely valuable. Summer is this awesome time to stretch our flexibility, and a lot of people like to take advantage of that. And the next stage is fall. And as we head into the school year, starting to figure out when to go to bed and when to wake up, and develop those new routines now instead of the night before school starts, really sets your family up for success that way. I think another thing is just anticipating what your school plans to do from a mask perspective. Talk about masks with your kids and talk about them respectfully. When you plan to wear masks somewhere, leave it to the fact that you plan to wear masks. I think it's amazing how much kids pick up on their parents' feelings and opinions and fears and anxieties around to mask or not to mask. So just keeping that to the facts, and we're going to wear our masks here to make sure we don't spread infection. We're going to wear our masks because we're careful around grandma and grandpa. We oftentimes schedule well child visits. Sometimes they're scheduled as sports physicals. It's amazing the little things that we can accomplish and the big things we can accomplish at their well visits. I talk to them as I look in their ears and as I look in their eyes and their throat. And do you have any allergies? What do you do about it? We listen to their lungs. We make sure that that sounds healthy. We, check out their abdomen. We talk about joints and joint pain. And it's amazing how much ground we can cover and questions we can get answered in an office visit. And it also just helps to update kids on their vaccines. Make sure that they're vaccine ready for school, and to answer any questions, just make sure that we're maximizing health before we enter the busyness of the school year. There are so many basics that we can just get back to, from modeling good behavior to talking about it and helping your kids to do it, like eating a healthy diet. I love to encourage people to eat 3 meals a day, get healthy snacks in between, but cut up your celery into pieces so that you can go into the fridge and easily eat it. Eating healthy, keeping healthy snacks available, exercise with your kids, find things to do together, go for bike rides or play tennis or shoot hoops or walk your dog together. But exercise can be a great way just to be together and to have that healthy movement, good for your bodies, good for your minds kind of activity. But sleep is so crucial to learning well and developing well. Different ages need different amounts of sleep. So if you have kids that are, say, 6 to 12 years old, allow them a lot of time to sleep at night. 9 to 12 hours is typically what they need. If you have teenagers, ages 13 to 18, we would recommend at least 8. Some of them need more like 10 hours of sleep at night. The best thing you can do from a sleep perspective is go to bed at the same time and wake up at the same time every morning. So allowing for those routines now really sets your family up for success when school does start. Get vaccinated. We have the vaccine in our offices now, which is tremendously convenient. We would love to help you out with that. What I would feel is the most important recommendation is put your screens away. This past year, one of the most difficult things for me at work was seeing all of the teenagers who are anxious and depressed about things that I had seen a lot less of in years prior. And one common thread there was that they were spending a lot of time in their rooms and they were spending a lot of time alone on screens. And some of that is just the way that the cookie crumbles. I don't fault any of their parents. And I think that we're all really doing our best here, and keep doing your best. I'm sure you're doing a great job, parents, and give yourself a little grace here. But when you get home, put your phones away, put your email and your text messages to the side, and look your kids in the eye and ask them about their day. Turn the TV off and make the kitchen table a good place for homework. Just really modeling that for your kids can be so tremendously valuable and help you build those relationships that will help them stay healthy. Mercy Health is here to help you. We would like to provide assistance in any way we can as you get ready for the school year. Please don't hesitate to reach out to us or call us. And thanks for being so invested in your kids.
Here's wishing everyone has a wonderful and safe year. And for more information or to schedule an appointment, visit mercyhealth.com.